little bit in terms of fertility. If you want to find
Yeah.
if you're fertile or infertile, you have fertile issues, do you think it's best to check it up, or you wait till your time for a baby? Adjoa, what would you say?
Great question. And I see a lot of women actually about this. So fertility is a massive issue. It's a hot topic. It always will be a hot topic for many reasons. And what I will say, and I'll try and keep it short because I could talk forever and ever about so many things. But fertility, what I would say is, it's a natural process to conceive. And the majority of people, so if you had 100 couples, and they were trying and they're having sex, and the key thing is regular sex, and this is what sometimes some patients make me laugh so much, because they tell me these things like, oh, he's in Ghana and I'm here and we're not going. I'm like, hun, no wonder you're not getting pregnant, so you have to have sex every 3 days at least, every 3 days for at least 1 year. But if you're doing that, provided you're having regular sex for every 3 days, 80% of couples will fall pregnant within the first year, and that's actually a great number, provided that the woman, I think, is less than, I think it's 40 or 40 regular sex. That will happen, and then in the second year that number goes all the way up to 90%. So if I see women that come in before a year, I just say, look, you need to give it a little bit longer. So if you feel that it's not working and you're concerned, I think if you're under the age of 40, give it a little bit longer. Maybe, okay, let's say 35, I think. Under 35, give it a little bit longer. But I think, we should be looking at other options or further investigations if you're a bit older, just to give you more time, because I shouldn't say God forbid, but if you need IVF or anything else, the cut-off criteria off the top of my head is completely gone, and it varies from borough to borough. So you have to be around, I think, 38 or 39, but don't quote me on that, but something like that. So the criteria is a bit stricter, depending what area you're in, if you're eligible for it. So what I would say is give it a little bit more time. And the other thing I will say that's really important for women is that the majority of the time, the infertility is normally the male factor. So women often are the ones that come and see me alone, and I think, where's your partner? Because in the majority of cases, it's usually there's a male reason, there's a problem with the sperm rather than the woman as well. And a fertility referral is a joint referral. It's something that you do together. It's not just the woman. And there's so much pressure that falls on women as well. Sorry, I went on quite a lot, but I've got lots of tips to improve your fertility. Well, not improve your fertility, but improve your chances of falling pregnant, which we can go through later.
Well, I'm ready to listen to it.
I was going to say, I agree with what Adjoa was saying, that the joint effort bit, because you get a lot of women come for themselves, like, oh, there's something wrong with me, without seeing a doctor, without, speaking to someone about it, and without a diagnosis that there's actually something wrong with you. And it's like, oh, I've been trying for a kid and there's something wrong with me. And I think that we need to look at fertility from a different stance, and talk more with your partners about it. Like, if you're both trying for a baby, you both should be putting in that same effort to find out, oh, why is it not happening if we're doing it the right way? Or are we doing it the right way? Or if it is just a woman and you've realised that, oh, I'm getting less periods, or I don't have regular periods, maybe I should check out whether I've got this PCOS. And going back to PCOS, just because you have PCOS doesn't mean you're infertile and not have a child. Just because you don't have regular periods doesn't nullify your chances of getting pregnant. And it's just a word of encouragement to women out there who do have PCOS. It might be a little bit harder, but it's not totally impossible for you to have a child and have a child.
Yeah. And I think the reason, that's why we say have sex every 3 days, because you want to you want to capture the best
time for you.
Best time, exactly, because you might not know when you're ovulating. So you might not know. So you want to try and capture the best time, and that's why I always say as well, ovulation kits. So they're basically sticks that you can wee on to see when you are most fertile. You can't just have sex when you're most fertile. As much as you just want to just do it then, you can't, because you may ovulate slightly before and slightly after. You just have to just keep going at it, and then you'll be all fine.
And another thing I want to point out as well, sorry, is stress and anxiety and all these things play a really key part in your fertility. I mean, your hormones are affected by your mood, your moods, your stress, your anxiety. Therefore, if you're stressing about having a baby and you're calm and you're all tense and he's all tense, and it's highly unlikely that what you want is going to come. But if you're relaxed about it, you have a relaxed approach to it, a hopeful approach, and it's not constantly on your mind, I think such couples usually have a better success rate than those who are always fixated on it, and you're having sex for the sake of having sex. You don't really want to be with each other like that, right?
Yeah. Do you know what, Nina? That's so true. Sorry.
That's okay. I was going to say, unhappy relationship do affect it.
Sorry.
Yeah, you could say that.
Unhappy relationship do affect it, Adjoa.
Yeah, absolutely. Sorry, I was just smiling so much when you're saying that, Nina, because it's so true, and it takes the fun out of having or trying for a child. It's supposed to be a nice, happy occasion, and if you've got it all planned down for it's not really the same. And what I always, and I've had this has happened I think 2 or 3 times now. I've had patients that have been trying, and I think I've referred them to the fertility clinic to be like, look, I need to refer you to see what the options are. Literally within a few months they're pregnant, and it's all because they were pregnant naturally. They were so worked up about trying to have this baby. The moment I'm like, okay, I'm going to send you to someone, it's like everything, they just completely relaxed, and then they fell pregnant naturally. So I was like, you see, it's your mind is so powerful.
Yeah,
as well,
it really is.
We can't believe it, but your mind is part of it.
Because you ladies touched on most of the time, people are always focusing on women. It's always women issue, but men too. Even when you go to church, women that are having problems come to the front. It's never men come out.
I've never thought of it. Yeah, me neither.
I didn't even think about that.
Yeah,
it's true.
When you go,
all the women are rushing to the front. Let me receive this baby.
Yeah.
Let me receive this baby. It's just.
And men tend to forget that they also have low sperm counts. Maybe that's why the woman is not falling.
Yeah. We bear most of the responsibility because you carry the child. Therefore, it's kind of like your sort of fault sometimes. And I think it's not just a cultural thing. I think even in the white community, they'll probably look at the woman first before they look at the man. But I guess educating our men is also important, or educating men in general, things that affect low sperm counts, smoking, alcohol. Some people might just have sperms that swim slower, and that can also affect fertility. And just their side of things is more of a lifestyle approach, I believe, most of the times. So giving up certain hobbies or certain food habits and things like that. And I guess if we educate both, you increase the likelihood of success when it comes to fertility. So
Adjoa, would you like to add on to that as well?
Always, you know me. I'm always talking. What I would say is, I definitely agree with everything you said with regard to fertility, and I think in terms of it's educating men, and I think smoking and alcohol and even your weight play a huge part. So even if you go over the amount of alcohol for a week, that's going to play a part, and also your weight as well. And the other thing is the testicles. So testicles are on the outside of the body to keep them cool. They're there for a reason. So you want to try and make sure that you know, sperm is so sensitive and they can die at, you know, just even at a small increase of temperature. So things like laptops, even having your laptop on your laps for, you know, long periods of time, particularly for men that are working from home, you know, that is going to increase the temperature of your testicles, which could also damage your sperm. So that's something that I always share with my friends as well. You know, men that like to go to saunas after their gym is also something. Cycling, so, you know, anything that makes your balls get balls. Sorry, that's not very professional. Testicles. Anything that makes your testicles get very, very warm can, you know, for a long time can cause damage. So cyclists, chefs can also have problems with their sperm as well because they work in very warm kitchens. So keeping your testicles nice and cool is advised. So tell all the men.
Yeah, I'm sure they'll be doing this.
Yeah.
So in terms of fertility, people do get ectopic pregnancy. What causes that? I was always intrigued about that. What causes it?
I'll let you go.
I don't know too much about this.
Okay, sure. So an ectopic pregnancy is pregnancy that happens outside of the womb or the uterus. So most commonly in one of the tubes. So you've got your ovaries that kind of, two ovaries on each side that lead down into the womb. And ectopic can happen outside of there. And it is actually it's an emergency. It's a life-threatening emergency because as the child or the baby is growing, it can cause pressure on that very, very tiny tube and it can rupture and you can bleed excessively and, you know, it's dangerous and it's an emergency. Now, in terms of what can cause an ectopic pregnancy, so if you think about it, anything that can causes disruption to the tube. So anything that can make the tube more sticky, more scarred, would mean that the traveling egg will get stuck. So the most common is chlamydia, so sexually transmitted infection. So that can cause some scarring of the tube as well. And it's not just chlamydia; it's untreated chlamydia. So chlamydia that you've had for a longer period, so without knowing. And we know that chlamydia in women is common, and it has, in the majority of cases, does not have any symptoms. So women may not know that they had chlamydia until they've had an ectopic. Not to say that every ectopic is related to that, but it's the most common reason. So so that's what causes it basically. So it's only through sex that you would get chlamydia, but I think as young people, we should encourage young people to get into a habit of having it done regularly. So with any change of partner, you should have a full STI check. And sometimes it can be a really difficult conversation for people that have been in relationships for a long time. You know, they'll say, oh no, but I've been with my partner for 6 years and I've only been, just get it done, because you just, not to say that people can be, you know, unfaithful. So I just say it's just routine and get it done and we can do it. And it's easy to do. And if you're embarrassed about going to have someone do it, you can actually, there's lots of self swabs that you can do yourself. So they can post you the kit, you do it at home, you send it off, and then they will text you the results or call you with the results. So don't feel embarrassed. And the other thing about chlamydia is that it's treatable. It's a very treatable condition. So if you do have chlamydia, you can be treated. So I always think to myself, what are you really scared about? Worst case scenario is you've got chlamydia and get some antibiotics. I'd rather that than not know.
I would say our approach, especially if you're sexually active, you should always check yourself out. even if it's with the same partner. You may have that level of trust. I guess that's a personal thing. But if you do suspect anything, you've got a rash or you've got something down below that shouldn't be there, it doesn't actually hurt to just check. Okay, what's up? It's your body, and you want to preserve your body, and you also don't want to give something to your partner as well. Mm-hmm. So if you're looking out for each other, it would be a good thing to just check yourself out and prevent things. It's all about preventing bigger things in the future. Check yourself out, and then if it's no, then good. And if it's yes, then it's still good because you get to clear it. So that's the approach I think we need to have, instead of the stigma of, oh no, I've got this, because you don't have it forever.
Mm. And that's what I was talking about in terms of people being embarrassed to seek help. And that's what as well, yeah. Well, ladies, I've learned quite a lot. I think we should do it again because there's a lot to talk about women.
Yeah, that's good.
Good.
Well, thank you so much, Adwa Danso is an NHS GP and Nina Bobby, a pharmacist. So I hope we meet again, and I hope soon. So have a good time.
Take care.
And take care.
Bye.
Take care. Bye-bye.
Bye.